The Prime Minister says he hopes to begin lifting lockdown restrictions in England from next month, beginning with schools, then non-essential shops, followed by pubs and restaurants. Mr Johnson also said that people will have to learn to live with coronavirus, echoing a suggestion by his Health Secretary that it could be managed like flu by the end of the year. Some scientists have warned against easing restrictions too quickly, even if the vaccination programme remains on target. Here's our political correspondent, Jonathan Blake.
Day by day, thousands more injections to vaccinate people against coronavirus. By Monday, the government is confident it will have met its aim of offering 15 million people their first jab. On a visit to a vaccine manufacturer in Teesside today, the Prime Minister said he was cautiously optimistic about COVID-19 being contained long term.
New therapies are being discovered the whole time, which are enabling us to reduce mortality, improve our treatments of the disease. So yes, I do think that in due time it will become something that we simply live with.
Effective vaccines are crucial to allowing restrictions to be lifted, and the government's promised a more detailed timeline soon. But Boris Johnson gave some idea of the order in which things would open up.
Starting with schools, we very much hope on March the 8th. That's got to be the priority. Our children's education, our kids' education is the number one priority. But then working forwards to getting non-essential retail open as well. And then in due course, as and when we can, prudently and cautiously, of course, we want to be opening hospitality as well.
But some advising the government warn that even with effective vaccines, a resurgence in cases can't be ruled out.
I don't believe anyone expects we're suddenly going to lift all the social restrictions. I don't think really anyone's thinking that way. We're just going to immediately lift them and not care what happens. But if for some reason we did choose to just pretend it wasn't here anymore at some point, then yes, there is the potential to go back to a wave that's a similar size to the one we're in now.
A drink in the spring sunshine might feel a long way off, and Downing Street has dismissed as speculation talk that pubs and restaurants could be serving us outside by April. But the more people get vaccinated and the more the government talks about living with coronavirus long term, the more the pressure to get life back to normal will grow.
If it's the same level as flu, we don't think for a second of locking down the country over flu. There will come a point where there will be a death rate from COVID, but it's at a normal level, and then we have to cope with that. Obviously, we still try and prevent it, but we accept it. I think we have to.
There's an acceptance in government that this lockdown must be the last in England. So while ministers feel the frustration, they're proceeding with caution. Jonathan Blake, BBC News.